Hey everybody, how's it going this evening? I'm Nick.
And I'm Amber.
And together we are Functional Movement Therapy. We're both doctors of physical therapy and we're here tonight to talk to you about low back pain. It is one of the most common diagnoses we see across all of physical therapy. And since we see it all day, every day, we thought that we would help a few of you prevent it and work through your discomforts a little bit easier.
Right. So between 65 and 80% of the adult population will experience an episode of low back pain within their lifetime.
Right.
So if you don't want to be a statistic, then we recommend you prevent this pain before it even starts. So that's why we advocate prehab over rehab. So in today's video, we want to discuss poor core stability, as we find it's a consistent factor in individuals that have low back pain.
Yep.
So stay tuned for some great education and exercises to improve your core stability.
Absolutely. Also, don't forget to comment below, subscribe to the page, and find us on social media for the latest updates on where we'll be posting, and our latest videos. We really appreciate the support.
Yeah. If you have any questions, please feel free to reach out.
Thanks.
So first of all, we want to explain the misconception of what the core actually is.
Isn't the core these washboard abs?
No, Nick. Even though this dad bod does great things, it's not the definition of a strong core.
Oh, shucks.
So let me tell you what a core actually is. So it's not just those washboard abs, it's not those models you see on the beach. So your core is actually comprised of your deep abdominal muscles and your paraspinals and even your pelvic floor muscles.
Right. So the deep abdominal muscles, one of the main ones being the transverse abdominis and the paraspinals, go around and support the spine and help to give it compression and maintain the proper amounts of space and stability to that lumbar spine.
So
right?
similar to a corset like a woman would wear?
Something like that, except I would never be caught in one of those.
Okay. But just so you guys understand what the core is, it's not just your abs. It's a combination of your abs, your back muscles working together.
Right. And when all those muscles work together and then we move properly, we maintain spinal neutral. Mm-hmm. Now, a lot of people don't know what spinal neutral looks like, feels like, and so that's going to be these exercises. It's helping you to maintain those proper motions and stability so that your lumbar spine doesn't do the rotating and the flexing and the bending that we often make it do.
Oh, so if I lack core stability, does that mean that will cause my back pain?
That will possibly cause your back pain. Some people get lucky, some people get very unlucky, and so it's a maybe.
Okay, so back pain due to poor core strength could present as sudden jolts of pain or chronic aching and soreness. Difficulty standing up after you're bending down and you come back up. There can be pain with that.
Yeah, difficulty in sitting or difficulty changing positions. Mm-hmm. So those are some of the main factors that we see going on. So stay tuned for our first exercise.
So as always, there's going to be these red flags or conditions that physical therapy may not be able to treat because there could be something else going on in which we would want to refer you out to a different doctor. And some of these symptoms include pain, tingling, or numbness going down one or both legs.
Right. The farther that it's going down the leg, the worse it is. So if it's getting to your feet or toes, find a specialist, primarily an orthopedic or a neurologist. Mm-hmm. Also, if you feel like the spine is completely locked and you physically can't move, that's another red flag.
Yeah, that doesn't sound good. What about pain with breathing?
Sounds great.
I mean, if you're taking any deep breaths and you're feeling sharp pain anywhere in your back, no bueno.
Nope, not at all. And another really big one is changes with bowel or bladder function. Really, really big red flag. Please seek help.
Pay attention to this. A lot of people do not bring it up because they don't think it's associated. with their low back pain.
Or they're too embarrassed.
Yeah, for sure. It most definitely could be. And you want to look out for, as always, pain that doesn't change with movement. If you're having consistent pain all the time, whether you're sitting, standing, and it does not change, then that's something we also want to watch out for.
Absolutely. But in the case that you don't have any of these exercises could be great to improve your core stability, improve your back pain, decrease your risk for injury, and improve your understanding and awareness of your posture and your core.
All right, so let's get to these exercises.
Let's do it. So the first exercise we want to talk to you all about is the transverse abdominis bracing. And this is that deep muscle that acts like a corset to the spine that we were speaking about earlier. Now, to activate the transverse abdominis is actually a little easier than one might think. You want to draw your belly button in towards the spine without activating any of the muscles while being able to breathe. And if you see here, Amber is activating that core, and you can notice her ribs expanding, legs aren't engaging, and her breath is flowing nice and smoothly. Practice this in sitting, standing, and walking to demonstrate your understanding of the movement. Okay, the next exercise we want to show you guys is a posterior pelvic tilt. Now, we like to control movement through the pelvis because everybody breaks down at the lower lumbar segments.
Yeah, Nick, can I just show this? So I just want to be really dramatic when I show this, and this isn't how it's going to look, but just so you guys understand what's happening here with my pelvis. So
it's a big curve of the lower back.
See all the space in here?
I do.
Okay, so what you want to do is go ahead and pull your hip bones up so there is no space in between your back and the surface.
Right, and it's really, really important to not do that by sucking in your abs or by pushing through the legs. You really want to control through the pelvic floor like we were talking about earlier. If you have control of your pelvis, you have control of your lower back. So that's a huge point.
Now, do I want to hold this when I come all the way down to the floor?
Just for a second, and then return back to your normal position, allowing that pelvis to roll backwards and forth. Great move to decrease any kind of acute or just light soreness of the lower back. Great move. Wonderful results.
All right, so now we're going to put all the pieces together. First, we did our TA contraction, just drawing the belly button up, okay? And then we did the posterior pelvic tilt, bringing the hips up and getting the back flat into the ground. Correct.
And we need these two components for this next move, which is called the dead bug. No, we didn't make up this exercise name, but we do like animal-named exercises, FYI. The dead bug is going to be lifting the opposite arm and leg to 90 degrees as you maintain that low back stability. So if you watch Amber here, her low back never changes positions as her limbs move through space. She's still able to breathe, and we're working on this opposite arm and leg movement that mimics walking, which is a lot of people's dysfunction, believe it or not. You can say, well, I can get from here to there, but do you have proper core stability when doing it?
And honestly, I'm getting tired already. It's a lot harder than it looks. You just need to make sure to keep this contraction the whole time throughout the whole entire exercise.
Correct. This is a strengthening exercise, so we would do our 3 sets of 8 to 12 to 15 repetitions and working through, and work to fatigue, but never ever pain. All right, for all you overachievers out there, this is the dead bug level 2. Now we're going to keep with the same pelvic tilt and the same transverse abdominis contraction here throughout the movement. But we're going to start in this 90-90 position here and extend the knee and hip as well as raise the opposite shoulder up a little bit higher. This is a lot more challenging to keep that low back nice and stable. And again, we're doing this exercise to mimic walking and really challenge that deep core muscle.
Make sure you are breathing.
Because purple is not a good color for any of our patients. How's that core feeling, Amber?
I feel the burn.
That's awesome. Good. But you guys got to give her credit because she is 4 months out from having our first child, and doesn't she look amazing? We really hope these exercises and videos help you to understand your low back pain, improve your low back pain, and understand movement a little bit better.
Yep, so please like this video. If you got something out of it, click subscribe, and we are going to have a few more low back videos to follow. Everything's going to kind of come together. So thank you for the support, and keep watching. Please reach out on the website, Functional Movement Therapy, if you would like to consult with either of us. Have a great one.